How do we discuss the results of the Oncotype DX assay with our patients? Here's some thoughts. Mike, how do you describe the results of the Oncotype DX and how it's going to be used in breast cancer treatment?
Yeah, that's a good question because, as you know, this is a lot of information and discussing it with the patients is very important, and we want to make sure they understand that. As a breast cancer surgeon, one of my jobs is to prepare them for when they meet with the medical oncologist so that they've had some of the information, they've been able to discuss it somewhat, so they're really ready to know what to do. When I sit down with the patient, I go over the actual report, show them the graphs, show them the recurrence score and the risk of distant recurrence, and then really sit down and tell them the difference between before the Oncotype assay, you got put into a large bag of people that kind of looked like your cancer. Now we're looking at this on an individualized way. And so we've taken you out and looked at your tumor specifically, and this is what your risk of recurrence is at 10 years. And I think people really get that. And it's much easier to discuss that as opposed to, well, in general, women that have tumors like this may have a risk of X. But here we're really saying, for you, your risk of recurrence is 12%, 15%. I think they really appreciate that individualized aspect.
Yeah, and then also, if those who have a low risk score know they're not going to need chemotherapy, and those with a high risk score know they're actually going to benefit from chemotherapy.
Right, and I think it prepares them for that meeting with the medical oncologist. And our medical oncologists are very happy that these women have come to their clinic having that introduction and ready to have the discussion.
Yeah, and I think they feel empowered by having that information, and it makes the discussion with the medical oncologist even more productive.
Absolutely.
Thanks, Mike. And I hope that this discussion is really helpful in understanding why the Oncotype DX results are so important in creating individualized treatment plans.